Hi, I'm Dr. Sood and I'm a radiologist at SCP and I'm a cardiothoracic and general radiologist by training.
Hi, my name is Charnel. I work at SCP and my speciality is CT.
So we often receive referrals from doctors who have patients that presented with chest pain, either in an acute setting or they've had chest pain for quite a long time, and the doctors want to exclude underlying coronary artery disease. So they're trying to make sure that there are no blockages within the blood vessels supplying the heart, which may need further intervention or be contributing to the patient's symptoms. So on CT, we get a very good understanding and overlay of the anatomy of the heart. So we can look at the structure of the heart itself, so the different chambers. If need be, we can look at their function, but our main area of interest is really the blood vessels. And we get a very high resolution look at the internal lumen of the blood vessels, and we can see if there's been plaque buildup and whether that's resulting in any significant narrowings.
It's a 3D image, so we can see the entire heart, all the coronaries in a 3D view. It's a very quick scan. It's not as invasive as if you had to go to theatre. It's a half a day at most.
So I think in the first place, it can be to confirm a diagnosis of coronary artery disease. Patients presenting with chest pain, it can be quite difficult for a clinician to determine what the cause is, and a number of things can contribute to that clinical presentation. If we confirm the diagnosis of coronary artery disease, then depending on the extent and the location of the plaques, can either guide management, and that could be conservative management with just lifestyle changes, initiation of medication to help lower cholesterol or improve other cardiovascular risk factors, or if necessary, help referrers to guide their intervention and procedures to try and open up those blood vessels that are narrowed.
For a cardiac scan, it's very important that we get your heart to a specific state so that we can produce good quality images for the doctors to pick up any problems. When your heart is beating too quick, it's more difficult for the scan to capture the heart in that specific moment. You come for your appointment on the day, take your blood pressure and ask you a couple questions about your medical history. Then we'll take you into our CT room for the scan. We'll lie you down on the bed. We place the ECG stickers on your chest and we connect it to the CT scanner. So we're going to first do a calcium score through your heart. What this does is see if you have any plaque sitting in the arteries. If you have a nice low plaque count or 0, then we will proceed with the angiogram. This will then be where we place a drip in your arm so that we can administer iodine injection. The iodine injection is a coloring agent, so it's going to fill the arteries so that instead of everything being a grey picture, it's going to be white and grey so that we can see the artery specifically filling up. And then we're going to spray some nitrolingual under your tongue. This is so that the arteries dilate so that they can be nice and thick, so that they fill nicely with the iodine. So it's just better image quality for the doctor to see if there's any anomalies going on in the arteries in the heart.
Once a patient's had a coronary study, it will help a clinician to direct their management as needed. A repeat study is usually considered in several years if nothing was done, just to monitor progression of disease. Or sometimes if patients have had a procedure performed and they re-present with the same symptoms, then cardiac CT can be quite useful to also assess for complications, in which case we might re-image them sooner.